Hello, it's a nursing professor back again for another episode of Fundamentals on Friday. And so today we're going to talk about the respiratory system. Now, the respiratory system is super important for you to know, especially for prioritization questions, because when we're looking at what do you do first, it's always airway. All right. And so remember your ABCs, airway, breathing, circulation as we go through this. So short description of anatomically what's going on. Air goes through your nose. It's warmed. It's filtered. It gets rid of extra debris that doesn't need to go into your lungs. Then we move on. It goes down to the trachea, to the bronchi, the bronchioles, and the alveoli. Now, in the alveoli is where actual gas exchange happens. And the gas exchange that occurs is between oxygen and carbon dioxide. All right? There are two key words that I want you to really pay attention to and know, because this is what really can trick you up on some of the questions. Respiration is actually where you have that gas exchange occur in the alveoli. Okay. Now, I know all along we've learned to count respirations, right? And when we count respirations, we're really counting the rise and fall of a person's chest. But that's not really what respirations mean. Ventilation is actually the movement of airflow in and out of your lungs. So that is really the rise and fall of a person's chest. The way I remember it is this, is that when a person is unable to breathe on their own, they're typically put on a mechanical ventilator, and that machine helps them with the rise and fall of the person's chest. So respiration is actually at the cellular level where that gas exchange does happen. All right. Remember that, because it can be a little confusing. And so when we're looking at things that do affect our ventilation, then it is the rate, how fast the machine may be set, or how fast the person is actually breathing, the depth of it, how deep they're able to take in a breath, or are they breathing really shallow, like almost like a pant. Lung compliance, if they have elasticity, that they're able to expand and contract their lungs fully. In any type of airway resistance that may be present, like a foreign body object that may interfere with that person's ability to ventilate their lungs. All right. And then, of course, we have other things like pulmonary circulation abnormalities, neuromuscular abnormalities, central nervous system abnormalities, because we know in our central nervous system, which the brain is a part of, and that if we have a brain injury, significant brain injury, especially at a lower level, then that person is considered brain dead and they're unable to breathe on their own. So remember that connection there. Now, there are some other factors that do influence our pulmonary function, like the stage of the lifespan and development. We know infants breathe faster, typically, than an adult. Their lungs are still developing at that time. And if you're talking about a premature infant, then many times they do have some respiratory problems, and they stay in the hospital a little bit longer because of the underdevelopment of their lungs. And the environment has an impact on your lungs. If you're a person who suffers from allergy, you know that allergy season can make things a little difficult. Therefore, it might trigger allergies such that will impact a person who has asthma, for an example. Stress can have an impact on a person's pulmonary function, their lifestyle, like do they smoke? Nutrition, exercise. You know, when you're exercising, you breathe faster. Okay, so that has an impact on your pulmonary functions, and certain medications as well, like your inhalers. Think about those. Okay, so moving on, let's look at some other factors that influence our pulmonary function, and let's talk about infections. Upper respiratory infections would be things like colds, sinusitis, that's the runny nose, pharyngitis, the flu, things that are currently in our environment right now. Lower respiratory infections are a little more challenging to treat because they're lower in the lung fields. And those would be things like RSV, which is respiratory bacterial virus. I always have a hard time saying that. Acute bronchitis, tuberculosis would be examples of lower respiratory infections. So let's use our nursing process. Let's go into the assessment. We're going to do a physical exam. Our physical exam is to actually look at a person's breathing pattern, their respiratory effort. Do they really struggle to actually take in a deep breath? We can use a pulse oximeter. That's a little device that goes onto your finger. We can get an ABG or arterial blood gas, which will give us more accurate measurements of that person's oxygenation and pH values as well. We can use inspection, palpation, percussion, and auscultation, and listen to see if there's any abnormal breath sounds that are there. Okay, so you need to practice that though. You need to practice how to listen for abnormal breath sounds. And some abnormal breath sounds could be anything from wheezing that sounds like a whistle to what else? Stridor, which sounds like a person has a blockage. Actually, in their lungs, it sounds just like that. Kuzmal, which are those deep, irregular, rapid breathing, labored breaths that a person can have. Crackle sounds like bubble wraps. Rhonchi sounds really like hoarseness, almost like the chest is rattling when a person coughs in particular. And a pleural friction rub would also be that. And literally, it sounds like the lungs are actually rubbing together. All right, so there are some diagnostic tests that we can do. And of course, that is your typical chest x-ray. We can get sputum samples. If you're getting a sputum sample, you want to get that off your first morning collection before the person has eaten or drank anything. Skin testing like PPDs or TB testing. Spirometry can also be that one of those diagnostic tests that you can take. Nursing diagnosis could be something like airway clearance impairment or alteration in breathing pattern or alteration in gas exchange. Any of those are possibilities. Our interventions would depend on the disease process, and frequently there are medications like inhaled medications like your albuterol in particular. If the person is doing really bad, then they might be placed on a mechanical ventilator. Chest tubes can also come into play if that person is not doing well as well, to relieve some of the tension to improve the breathing in your person. Because the optimal functioning of all of this is to improve respiratory functioning and oxygenation in our patients. Okay? All right, so some of the other things we might want to do is to teach people about avoiding their allergens, to stop smoking, if they live in an environmentally challenged area, to make sure that their windows are closed, that they may have air filters and things like that in their home. Also, if their pulse oximetry is lower than 95%, then they might require additional oxygen, which can be delivered as a nasal cannula or a mask, depending on what that person's needs might be. And then, of course, we have to evaluate. And once we evaluate and we see our patient is getting better, then it's like, yay, they can start to improve. And if a person starts at a high level of oxygen delivery, you want to be able to decrease that as best as possible. Okay, so if they're doing well, 95% at 4 liters of oxygen, then try them at 3 liters of oxygen to see if they still are able to handle that. Okay. All right. So some other common disease processes that you might see: asthma, COPD, pneumonia, tuberculosis, pulmonary emboli. Know that you should know words like dyspnea, which means difficulty breathing, cyanosis, which means that the person is not getting enough oxygen, and know those abnormal breath sounds. So I hope that helps with the respiratory system. Have a great week, and I will see you next week for Fundamentals on Friday. Bye for now.